Hello, the great Indian festival, the festival of lights and joy, Deepavali, when lots of candles and other sources of light are put on, and it is tried that the darkness is dispelled from the mind and lives and from the families and the nation. So, on that occasion of festivity, all peoples take lot of desserts or sweets. They are distributed and in the homes they are made. Today we have the privilege on our channel with Mrs. Neeta Dewan, my wife. She is double master, masters in biology and masters in diet and nutrition. And here we intend today, the purpose of the talk today is to find out the common types of desserts or sweets which are available in the market, which are good for health and which are not good for health, and which can be made at home, and what desserts you should take, which should make you healthier and does not spoil your health. So, we coming to common desserts here one by one. Most common dessert in India, which is celebrated for any good occasion, people distribute one type of sweet dessert. If you can make it out, that is laddu.
Okay, happy Diwali to all the viewers. And it is the festival of sweets. Diwali is the festival of sweets. So I remember that when we were in our childhood, it used to be a dabba of mithai, which used to be, given to each other as a sign of Diwali. So still, sweets are a very important part of this festival. And as Dr. Devan has just said, there are some sweets which are better for your health than the others. So we'll start with the most common one of them, that is the laddu. Now, laddu is a round sweet which can be of many types, and depending on the type, the health benefits are different, or it can also be harmful for your health. Like example, the most common laddu is that moti chur ka laddu or the bundi ka laddu. So in that laddu, we have the fried bundi and dipped in sugar syrup, and then you make it into a ball. So I think in this season you should avoid that basin, that bundi ka laddu. But if you are a laddu person, then you can go in for besan ka laddu, which is made from besan and chickpea flour, which is more healthy. And the other thing is that we have also, just the winters are starting, and people also have flaxseed laddu, which is very good, rich in omega 3, and very, very good for your health. So you can try that also. You can try your dry fruit laddus. You can grate, or you can make a powder out of the dry fruits, mix them in dates and make small laddus at home, and that is a very healthy snack.
Okay, madam. Now I have few questions for first sweet that we are discussing, laddus. Now, first thing is that I am a surgeon, and I know our great ancestor surgeon, Susrata, which is very popular surgeon who started surgery in the world, I think, first surgeon in the world, and was doing lot of plastic surgery, many other surgery. There are statues of Susrata in German, especially many universities, and in India, of course, we is one of the common, we take inspiration from him. He was using some til ke laddu for as antiseptics.
Yeah, sesame seeds are a very rich source of protein. Like a 3 tablespoon of sesame seed will have 5 grams of protein, and they have very good oils are present in it, and it is antiseptic, antibacterial, antifungal. But the thing is that the sesame seeds have to be dehulled. उनका छिलका उतरा हुआ होना चाहिए, क्योंकि there are some anti-nutritional factors like oxalates and phytates which are present in the skin. तो आप उसको उतार के, sesame seeds are very good for your health, and you can convert it into a laddu also.
Okay, thank you very much for that. I would like to know what is bundi. Like bundi ka laddu, that yellowish Laddu is the most common laddu. Anything good happens, the marriage, a person passes an exam, there is a good news, the people distribute laddus. What is bundi?
Basically, uh, you take the besan flour, and though I haven't made it ever, and I think you kind of take a sieve and you chano it and you fry it. So it is when you fry it and then you put it in a boiling syrup of chashni, sugar syrup. So it becomes high in fat, high in sugars, and so that is the point which harms your health. That is the frying part and the dipping in the hot syrup of sugar. So that is why it is not good for your health. Any sweet for that matter, which is deep fried and is made in the syrup, like for example, jalebi. Jalebi is again made from maida, which is the one of the finest form of sugar, and then it is fried, deep fried. And one thing is there that they keep on using the same oil, so there's a lot of trans fats are generated in that oil, and then they dip it in the boiling syrup, sugar syrup. So again, this is again going to be very harmful, high
Madam,
in fat,
sorry
high in
to
sugars.
interrupt you. We have to, you're not finished with laddus, they are evergreen. So, my mother used to make laddus at home. So, that besan, this gram, which is very rich in proteins. So, make a solution, thick solution of that. And because I was very greatly associated with my mother, so I will be doing everything for her, with her, so that there was a sieve with the pores. So we will there will be oil below, which will be very hot. So we will pour the that thick solution, and that will form fall drop by drop into the oil, and it will bit of splashing will take place because the water is taking place. It will turn into steam, and it will splash a bit. So we have to be distant. Madam, this number one about this thing, what you said about sugar and oil. But I think there is another aspect in India or anywhere, that is malnutrition, that is protein, calorie, nutrition, please. And that is in this laddu, which is, for children who are growing children and people who are suffering from any disease, malnourishing disease like tuberculosis, which is common in India, or typhoid. So anything which has made the person lose the muscle and fat and energy. So there is sugar, there is protein, and there is oil. So that person can quickly recover instead of giving the protein infusion as a doctor, or the oil infusion, the intralipids, or something like a syrup or something. Syrup means sugar. So these things, and for growing children who are active, or for athletes, people who have to work. I know there was a doctor with me in CMC Christian Medical College and Hospital from Malaysia. He used to go for 40-kilometer walk, and he used to eat a lot of the sugar. So regarding this, another second question also I'll ask about the laddus only, that laddus can be added with saffron and lot of nuts and raisins. So nuts are also rich in basic, elements like potassium, calcium, and proteins, and raisins also, and saffron. So these can be, like you said, fruits also can be added, dry fruits or whatever you call nuts, also dry fruit. But you can add fresh fruits also. So regarding these two questions, okay.
Well, when we talk of laddu, we are talking of a round sweet which can be made with so many different type of things. Now, when we for a growing child, having a laddu is not going to harm them. Is going to be good for them. It is high caloric food, and they are growing children, and they will. It is not going to harm them. We are talking about the benefits and the harms. So, but when you talk of a patient who's got typhoid, that patient cannot have a laddu because it is high in fat and your intestines are compromised, and you cannot have a laddu and you won't be able to digest it. You have to have soft diet for that. Similarly, for a patient of tuberculosis, you don't know whether he has anorexia or what form of what is his health status. So when we talk about people who are ill, we are not recommending laddus for them at all. Laddus can be enjoyed by children, by adults, but you can look into the portion size. You can have a little bit of laddu if you are diabetic or if you have heart issues, then the laddus are definitely not for you. And the second question, it's gone off
No,
from
no, it's
there.
already you have answered that. Yes, as a doctor, we are having this a great privilege to have. There is two aspects like that. At the acute illness of typhoid or tuberculosis or a recovery stage, when the person is being treated already and the intestine are in the first stage in typhoid also, we don't recommend any solid diet. We recommend liquid diet because it's basically an intestinal problem, infection in the intestine. So then, because there is a risk of perforation, means becoming a hole in the intestine, which happens. I have operated on so many patients. So, but when the patient has recovered, similarly other debilitating diseases, and basically so many people are poor and unprivileged. So, if they are given laddu form of like in the schools, like children are there, if the government is giving a midday meal to them, so midday meal mean they are giving some little vegetable or just some gram or thing. So if they are given things like that which are nourishing to them and which will be stored inside them, like fat will be stored inside them, and proteins will also be. So this is about laddus. So now the second common thing is, and I will personally say that everybody can make laddus at home with ingredients of their choice and clean and whatever you can add. So one thing I think you may recommend is that make laddus at home.
Definitely. Definitely. You should put whatever you like, wholesome food, and you should make a laddu at home. It's
And
really
the
good.
pinni, my mother used to
Pinni
like.
is another form of laddu which was made during our childhood by our mother at home and put in a big drum, and we used to have it every day. So that
Same
was a
here,
good thing.
same here. That's why we
That's
married.
another kind of
That's why
laddu.
we married. My mother used to do the same, and there was a lot of nuts and raisins
Yeah.
and gum from the trees.
Yeah.
Huh?
So there was they
Correct.
are all energy dense foods. When you have a pinni, it's a very energy dense food. You have carbs, you have fats, you have essential oil from all the nuts, proteins. So it's very good.
Another thing good about pinni is that it does not require any preservation, does not require
Yeah,
refrigeration.
because of all the oil you've put into to fry the flour, so you don't need it.
So my mother used to fill a big this
Yeah.
pipa, we got tin box, and we used to keep on eating for go for playing and running, take one, go for playing and running. And I think you gave me when I went for my job in Central Hospital, Homs, Libya, and it was not clear that I will be able to get proper food there. So she gave me the matis and the pinnies,
Yeah.
so they were, you can carry them like that, and they are dry and sort of.
See, it is basically the portion size which matters when you are having food like that, and you should have a small portion, and you should keep your health in mind.
Yeah. So these are good things like you make one. Madam, we have discussed a lot about laddus and motichur laddus, and now Uh, so next topic, enough we'll discuss. There are so many things already. 13 minutes, 14 minutes. Our talk is gone. We will take so many sweets are there. We'll discuss another sweet, another letter. Keep it up to laddus. And the message that take is laddus can be good, laddus can be bad. They have to be selectively taken. If you are have diabetes, sugar, high sugar levels, or you have blood
You
pressure.
have cardiac problem, you have heart issues, then you should be very careful while consuming them. Make the laddus at home. Use adequate amount of dry fruit. Keep your oil or your ghee in control, and you can have it.
एवरी यू आर ना लीडर आर सेइंग आत्मनिर्भर बनना है, तो आप बाजार में से लड्डू में क्या डाला है क्या नहीं डाला, वो तो जो कलर्स होते हैं ना, वो कलर्स वो भी जो एडिबल कलर्स होते हैं, और वंस आर एडिबल कलर्स एंड वन आर आर्टिफिशियल कलर्स. Artificial colors are chemicals which can cause cancer even. Saffron is very costly, real saffron, but saffron color is very cheap. So do you think they will add the very high cost saffron? So this is the question is, please take home message. Make your ladoos yourself at home. Thank you very much. We'll
Thank
meet
you.
again.